thank you for joining us, Dr. Titus. And we know you have planned, to talk a little bit more specifically about the health aspects of hemp and the endocannabinoid system and that sort of things.
Well, Yanni, thank you for the wonderful introduction, and it's certainly great to be with everyone today. CBD has been newly discovered as a nutraceutical since our company really developed this application back in the year 2011. And even though CBD was discovered by US research scientist Dr. Roger Adams back in 1940, CBD previously had been known as the hippie's disappointment because there was no psychoactive effect when smoked, unlike marijuana and THC. Back in the 1940s, Dr. Roger Adams in 1942 was actually awarded a US government patent on his isolation of CBD cannabidiol from what he called a red hemp oil. And certainly today, with the evolution of CBD as a nutraceutical or a food substance, now for many of us, the very best thing we can do for our overall health is to supplement our largest self-regulatory system, the internal or the endogenous cannabinoid system. And we do this by using plant-based cannabinoids. Now, with the endogenous cannabinoid system, nearly every physiological function within our human bodies rests on the proper function and support of this internal endogenous cannabinoid system. So now let's go ahead and review some of the science. Cannabis has given us tremendous insight into the functioning of our own bodies. The endocannabinoid system was discovered thanks to investigations into how cannabis affects the human body. And the initial discovery of this endogenous cannabinoid system was made by Drs. Alan Hallett and William Devane at St. Louis University Medical Center back in 1988. Now, the endogenous cannabinoid system serves vital functions within all humans, as well as within all mammalian creatures. So our dogs, fish, cats, horses, cattle, all have these internal cannabinoids that their systems produce. And the main function of this system is to maintain equilibrium or the balance among the many internal systems without our conscious awareness being involved. So this system goes on and operates behind the scenes, so to speak. And of course, our internal systems will fluctuate based on interactions with our other systems within the body inside of us, as well as will fluctuate with changes in external conditions. And at times, the endocannabinoid system functions as a go-between for the immune system, the nervous system, and the body's internal organs. Now, without a properly functioning endogenous cannabinoid system, a whole host of physical and psychological problems can begin to arise. So here we want to illustrate the main components of the endogenous cannabinoid system, and these are represented by endocannabinoids, chemical compounds that our human bodies do make, cannabinoid receptors within us, as well as enzymes that tend to degrade our internal endogenous cannabinoids. Now, together, this system helps to achieve a balance of health that one can augment and influence in certain ways with the use of cannabis, or more particularly with hemp and non-psychoactive CBD. Now, besides the chemical component, the endogenous cannabinoid system is a tremendous cell signaling and cellular communication system. This endogenous cannabinoid system allows for a two-way flow of cell signals along nerve pathways. Thus, the endocannabinoid system can monitor cell communication and serve to potentially correct any abnormal or incomplete cell communication. And the cannabinoid receptors, let's discuss those for a brief moment. Our CB1 receptors are widely expressed in the brain and spinal column of the central nervous system. and these will relate more towards the body's neurological function. Your CB2 receptors are widely expressed in the gut, the viscera, and internal organs of the body and relate more towards the body's immune function. And certainly, these cannabinoid receptors can interact with both endocannabinoids that originate within the human body, as well as phytocannabinoids, those exogenous or plant based cannabinoids that we ingest and we naturally have in our diets. Talking about endocannabinoids, our human bodies produce internal cannabinoids. The most recognized one is known as anandamide. This is a mood enhancer, promotes feelings of happiness, may be very helpful in fertility, learning, and memory. Now, the other endocannabinoids got a very long chemical name. It's abbreviated by 2-AG, technically 2-arachidonyl glycerol, but it's the most abundant of our internal endogenous cannabinoids. And 2-AG plays a role in pain management, appetite, and various immune system functions. 2-AG exerts effects on blood vessels and heart, can possibly play a role in suppressing seizures, and is expressed in mother's breast milk as the first food that the mother feeds the newborn child. Both cannabinoids are derived from arachidonyl acid, which is an omega fatty acid, and this occurs within the nerves of the body. Now, the metabolic enzymes will play an important role in the endocannabinoid system because they're responsible for both the creation of the endocannabinoids as well as their degradation once they've fulfilled their purpose. Now, unfortunately, the endocannabinoids, the cannabinoids that our bodies naturally produce, are very quickly degraded by enzymatic processes. So the shelf life can be just mere seconds and maybe a minute if we're so lucky. And thus, this brings us to the need to supplement our diets with plant-based phytocannabinoids, as they're not as quickly degraded by enzymes and thus can confer greater or longer-lasting physiological processes. So these plant-based cannabinoids, again, will have a much longer shelf life within us. And certainly, the plant-based cannabinoids will not be degraded by the metabolic enzymes. In fact, the plant cannabinoids actually degrade those enzymes. So when you start taking plant cannabinoids, not only do your levels of the plant cannabinoids increase throughout the bloodstream, but also your circulating levels of your endo or internal endogenous cannabinoids will also be improved, and this will complement the phytocannabinoids, and thus we get a true entourage effect when we start consuming non-psychoactive plant cannabinoids. Many of us have become cannabinoid deficient, considering that cannabis has been made illegal and removed from our diets for the past 3.5 generations. But this clinical endocannabinoid deficiency concept was first proposed by a Dr. Ethan Russo, who was a very famous neurological researcher. Now, Dr. Russo found that adding plant-based cannabinoids to a daily regimen with his patients shown them to overcome some of the very challenging health conditions. And thus, again, the plant cannabinoids having a longer shelf life within us, and of course, degrading those metabolic enzymes, and thus improving the level of circulating endocannabinoids. Again, many patients came to much higher levels of health and wellness and started to overcome some very difficult treatment-resistant conditions. So again, one is getting this amazing entourage effect of plant cannabinoids plus internal cannabinoids that, again, really move our health to much higher levels. Now, the importance of the endocannabinoid system can be shown in many physiological activities within us, certainly the stress response. Now, certainly the endocannabinoid system has tremendous prominence in the body's immune system. And the ECS is critical to functioning or the proper functioning of the immune system. And the endocannabinoid system is thought to play a role in regulating cytokine production and other immune responses. Thus, this cytokine storm that happens with some COVID patients can potentially be taken down very nicely. And study and research now is looking at CBD's role in terms of COVID. Well, CBD is really considered a allosteric modulator in that it does not directly latch on to the endocannabinoid receptor sites like your THC will, but instead, the CBD will attach itself to a different part of the cell membrane or the cell's ligand, where it has a powerful but a little bit more indirect effect. So CBD will actually help to change the shape, the orientation, as well as the permeability of the cell membrane. And as an example, CBD seems to improve the sensitivity of the cell to insulin, which many type 2 diabetic patients have experienced a lowering of their A1C scores by utilizing CBD. Now, plant source CBD inhibits the breakdown of the endocannabinoids, as we've mentioned, allowing them to have a much more prolonged effect. And it's certainly thought to influence the functioning of inflammation, particularly as CBD in its raw plant extracted form, your CBDA or cannabidiolic acid, CBDA is working so particularly well on inflammation. Now, CBD can potentially lower levels of stress throughout the body. And CBD is shown to have a very positive effect on a receptor site known as 5-HT1A. And this relates to the body's production of a hormone known as serotonin. So, serotonin is a feel good, happiness chemical compound that gives you feelings of contentment and well being. So, by improving the serotonin levels in CBD by its action on 5-HT1A receptors, anecdotally, people generally will feel less stress, possible lower levels of anxiousness, will feel better about themselves. And certainly, many people report feeling better able to cope with the current world situation in dealing with COVID. Now, CBDA has also great central nervous system relaxation effects. So, anecdotally, people not only use CBDA for advanced pain relief, but also for its sleep benefits. And thus, our CBDA is an integral part of our hemp sleep formula. And during deep, restful sleep, the body's glymphatic system will kick in. And this is a system that helps clean up toxins from normal cellular activity. And when we're in this deep state of restful sleep, the brain's system, the lymphatic system of the brain, known as the glymphatic system, will clean up any residual toxins from daily activities. And thus, CBDA users report waking up feeling refreshed and with a clear and very focused mind. We really believe that CBD and these non-psychoactive cannabinoids are vital and necessary nutrients. And we believe that in dietary supplement or in food and nutritional form, CBD and the other non-psychoactive cannabinoids provide vital and necessary nutrients which help support our higher levels of overall health and wellness. And in this botanical form, one does not necessarily need to be sick. One does not need to be a patient or have an illness in order to use and benefit from botanical CBD to improve their overall levels of health and wellness.